Hey you guys, let's chit chat about the Snellen chart. It seems so simple, but when working with my review students, and honestly, when I think back when I was learning it in school, it's so easy to mix up what the top number equates to and what the bottom number equates to, right? So you know what the Snellen chart is, the eye exam. You can see it on this image here, where we are used to doing it as the patient ourselves going to our normal doctor's visit, and they're examining our eyes, as well as providers being that one to actually have to give the results for this, right? So when you think about the Snellen chart, there's two numbers. There's a top and there's a bottom, right? You know, 20/20 means perfect vision, etc. But if you are faced with an exam question, if you're explaining to your patients, whatever the case may be, you need to know what you're truly reading. So the thing that I tell everybody is just understand the top number will always be 20. You know why? Because think about when you go there as the patient, or if you ask your patient to do this, there's already a piece of tape that they have to stand at to do the actual exam before we tell them to cover one eye and read what they can read. So that tape, that line, that X, whatever it is measured out 20 feet away from the actual Snellen chart. The Snellen chart being the one with the big E, etc. So that's where the top 20 comes from. So that will never stray. So you always know that you are saying at 20 feet, this is what the bottom number is you have scored, okay? The bottom number is the patient score or your score if you're the one being tested. So you do that based off the chart tells you. It has numbers, 20, 30, 40. So whichever is the smallest line they can read at 20 feet away is what they're scored. So when you see that it says 20/20, that means at 20 feet away, that patient is seeing what someone with normal vision would see at 20 feet away. If it says 20-40, that means at 20 feet away, you're seeing what the normal person would see at 40 feet away. So just remember that top number equals 20 because you are 20 feet away from the Snellen chart, and the bottom number is your score based upon what a person with normal, perfect vision would see at that distance, okay? And for Work It Out Wednesday, I'll give you a scenario for a practice question. So follow us tomorrow on all of my platforms so you can see what I really mean. If you're still kind of hung up, you probably understand the topic, but I like to give it to you in a question style. So when you face it on boards, you understand what I'm saying, okay? All right. I hope you found this helpful. Share with a friend, colleague, or whomever that you think may benefit from this. And meet me back here next Tuesday. Bye, y'all.